Welcome to our clinic. I want to introduce a new machine for rejuvenation of vulva and therapy of incontinence, stress or organ incontinence. After, when we introduce the machine, we go to all therapy for introduce. So this is our new machine, what called Jett Plasma for hair 2. This machine is very user-friendly and easy to make this procedure of women. Perfect what is on this machine is that it's not painful. This is very important for women because all treatment this type of disease you must use operation method, and this is not needed for this type of rejuvenation and therapy of incontinence. So this is a probe what the woman must have during the procedure in the hand. This is one thing what the woman must to do in this therapy. After, here you have pedal where you can control the machine. We have two probes. This probe we use for rejuvenation, vaginal rejuvenation, and this we use for incontinence, stress or urgent. This is important for this therapy, and this very intense because we have here this plate. What is you can see here? It's concentrate energy, and this is important for therapy of incontinence because it's concentrate of energy of this probe. So first we start to explain how we do therapy of rejuvenation. This rejuvenation is good because the vaginal get tight, so it's very good for sexual life. This is very important for prevention of inflammation. This is very important. After this rejuvenation, the tissue getting better be wet, and this is good for healing swelling of vagina. This is very good. We use this type of probe. Here is the small plate what we concentrate the energy. So we put, when we start the procedure, we put here just a little bit part of gel, and we slowly put this probe to the vagina. We go with the probe very slowly inside when we stop of the cervix. So inside we turn around the probe and getting slowly out. After, we go once again inside, turn around and getting out slowly again. Yeah, this is very important. I use on my clinic of intensity of 8. This is very important because the 8 is the most energy of this machine, and it's very good for a better effect. If a woman have a little bit pain inside, you can getting the intensity getting down. Yeah, but for all my women, I use every time 8 intensity. So this procedure, it can be about 15 to 20 minutes. I use for this procedure, I use 20 minutes for one session. After when we finished, we wait 5 to 10 days for the next treatment. We on our clinic we use free treatments after 5 to 10 days, and after when we finish these free treatments, we waiting 3 months for the best effect. But after one treatment, the woman after 3 to 5 days feel something changing, feel the changing of rejuvenation, feeling better. The vagina is very a little bit tight and smooth, and this is what the woman want to. This procedure it's good for sex too, because part of women have better feeling after this procedure and have more orgasm than before. Now I will show you how to use this probe, what is using for incontinence, stress or urgent. This probe have perfect shape because when you put inside, it's very comfortable for the doctor. Normally, they before saying that we do only therapy of under the urethra. Yeah, so it's about 4 to 5 centimeters, and we do like this. But in my clinic, I using this probe slowly and go to all the part of upper part of vagina. So for me, it's I think that it's better effect for incontinence and urgent incontinence. I use very slowly and go inside. When I stop and getting out very slowly to open of introitus. So this procedure I do about 50 minutes to starting incontinence, and about 20 minutes to incontinence type 2 or 2 degrees. When I use this probe, I go very slowly. It's important that this shape must be up. Don't do it like this or like this. Just under the urethra and getting inside and outside very slowly. And this procedure I use intensivity 8 and do very slowly for better effect. Yeah. After this procedure, the woman tell me that after 4 to 5 days have something changing. So when before have stress incontinence, so it gets better and better every day. After third day and fourth day, it's getting better and better. After 5 days to 10 days, we make the next treatment. We do the same, and after this procedure, after 5 to 10 days, we do third treatment. After these 3 treatments, we waiting 3 months, and after 3 months, it's better and better effect. After 3 months, patient come back to me and say what is good, what is bad, what is something change, and we after this procedure, if it's not 100%, we can make 1 or 2 treatment more. Yeah, this is for my clinic. But all girls what I have and women, it's after 3 procedure they don't come back. So it's very good effect for urgent incontinence. My friend would have 75 years old, have many years urgent and stress incontinence, and after one procedure they said to me that urgent is dismissed. She threw up the medicine what they used maybe 5 or 6 years, and stress incontinence is better about 90% like before treatment. So it's very good effect, and this is directly from my friend, and they always tell to you the truth. Yeah. For the starting this machine, I use this probe under the urethra, just like tell me the company. So I use 15 minutes and do like this, just under the urethra, and after a little bit time, I starting using this probe under the urethra and getting more down, yeah, for the down to the cervix. And this procedure I do about 15 to 20 minutes, and I think that it's a better effect of stress or urgent incontinence, better than you use only just this 4 to 5 centimeters. For a better effect of stress incontinence, urgent incontinence, rejuvenation of vagina, I do one complete package. So for the best results is when I using this probe and do rejuvenation 20 minutes, and after this procedure I do this probe 15 to 20 minutes like this, and when you use these two procedure, it's getting maybe 40 minutes for one treatment, but for me it's better effect for incontinence, rejuvenation, like this probe and this probe alone. For this procedure, when I use both probe, I use intensity 8, not lower. And after this procedure, I have between the treatment 5 to 10 days. And you always use 3 treatment minimum. When the woman has rectocala, we can use this probe and do about 15 to 20 minutes. Just do like this, and rectocala it's a little bit getting smaller. This is my experience. So one procedure 1 week we can use with this probe. It's healing injury after the birth, after the episiotomies. So we use this probe like this, and when we find all the part of injury, and we go slower, getting inside and outside like this, and I use about 10 to 15 minutes, and it's getting better and better to heal. Intensity it's 8, and procedure is the same, 5 to 10 days, 3 treatments. We can use this probe. We can use after episiotomy when you find the scars and it's very hypotrophic. So we use the probe and we use the same like this, and the scars it's getting better, getting smooth, and after this procedure its sex is better. On this machine we can use the third probe. We calling flat, and we can use this type of probe for rejuvenation of labia majora et minora. So This is different part because here we must use so much gel to not harm the patient, because when you don't use the gel, it can be a little bit pain. So on my clinic I use so much gel and lubricate all part of labias, and after I do like this procedure, and we're getting about 5 minutes to all part. So you do small labia from this side, you can use introitus, yeah, and everything around, yeah, and about all part 5 minutes. And we do on intensity 8 and do about all procedure is getting about 30 minutes, and we use free treatments up to 5 to 10 days. This procedure is very good because all labias is getting smaller, and introitus is getting tight. So it's very good for aesthetic view and getting for better sex, because it's getting tight. And after this procedure, it's getting everything closed, and bacteria don't go inside the vagina, and it's getting better for prevention of inflammatory. What is very interesting, after the free procedure, I can see by my patient when women in menopause have no ridges, so the tissue is very smooth, and after the free procedure the ridges arise again. So it's very interesting after free procedure of woman what is in menopause. So I am a gynecologist, so I use this machine, and I use for my medical practice the second type of plasma lift medical. This is this machine, and I'm using for removing condylomas or everything fibromes and around the vagina. It's very friendly to use, and I use very often. Many people ask me when I do the training, how is after the treatment, what the woman can do or not can do. So after this treatment, a little bit part of women have a little bit discomfort, because use 40 minutes probes and getting inside and outside. So you can use the hyaluronic gel. It's always subsuppositoriums with hyaluronic acid, when you can use 1 or 2 days when the discomfort is dismissed. But 90% of patients don't use because they have no problem. Some people ask, it's this procedure working for all women? I always told the people that it's working for young women to old women. My oldest patient, it was 89 years old woman, so I'm working, so it's good.